Okay, pleased to say I'm joined in the studio now by Dr. Mads Gilbert. He is a physician, humanitarian and an activist. And Mads, welcome. As I understand, you spent quite a lot of time in the Gaza Strip on and off over the years, so you know the region well. You learnt a lot about the people there. Just to start off with the most recent events, are you still in contact with anyone who's in Gaza at the moment? Have you any sense of what the conditions are like in the hospitals there?
Yes, absolutely. And they're getting worse by the hour. And when you said that 104 died, they were actually killed during the last attack on Rafah. And, you know, the hospital capacity is down to only a minimal capacity because one after one of the hospitals have been taken out, either closed down because of lack of electricity and water and supplies, or bombed, or the staff have been arrested, like in Nasser Medical Complex. So the total medical capacity, both in the primary healthcare sector and in the hospitals, are diminishing as the attacks are increasing. The last one I talked to was one of my colleagues through many years who had been arrested by the Israeli occupation forces, kept for 2 weeks and tortured. And it was extremely painful to talk to my very respected, young, extremely clever Palestinian doctor who have been then one of the many hundred who have been abducted and tortured. And the last numbers from the WHO sums up that there has been almost 400 Israeli attacks on Palestinian healthcare in Gaza.
That's an incredible number.
And it is.
And the question that begs itself every time is why? For example, you know people who've been abducted. What information are they trying to get from health officials when they abduct them and torture them?
Well, you have to ask the Israelis what their aims are. But I think what they've been trying to do is to squeeze these good-willing, respectful healthcare workers to give false, testimonies to the fact that it's not the fact that the hospitals are used for military use. They never have. I've been working in Gaza for the better part of over 20 years, and these are respectable people, and they are following international law. And, you know, the Palestinians are patriots, but they are not necessarily political activists. So these numbers are extremely worrisome. And also, during these 378 attacks on healthcare, there has been 659 killed. Half of them healthcare workers, half of them patients and relatives. And listening to your sum up of the sanctions against Russia, it is incredibly provoking for me to listen to the new US sanctions against Russia for things that they claim are, you know, some sort of irregularities or the occupation of Ukraine, which we all are against and support.
Well, you've got two wars, haven't you? And the United States seems to be doing nothing to stop one and doing everything to stop the other. I mean, does it feel like hypocrisy?
It's a complete double standard. It's a horrific double standard. For the third time, they vetoed an almost unanimous suggestion of ceasefire in Gaza the other day. Even UK did not veto but abstained, and the other 13 were in favor, and US for the third time vetoed. They are actually not only backpadding, but, you know, chairing the Israeli attacks in the way that they are behaving. They could have stopped these atrocities in 1 day if they told Israel, you will not have more financial support and no more weapons from us. And the numbers are incredibly worrisome. This is the last OCHA report from UN, 29,313 killed, among them probably around 12,000 children. You know, the next generation will ask us, why didn't you stop it?
When you talk about all those numbers, one would have thought that one child was too many, that one woman was too many. Anyone who's not a combatant in this is too many. It can't be an accident. I'm trying to stay objective here, but this can't be an accident. I mean, what do people there on the ground say about the fact that medics are being abducted, that medics, their families, children, women are being killed? Does this feel like it is a deliberate tactic?
Absolutely. And I mean, for us who have been working with Palestinian healthcare for the better part, I've been working with them for 40 years, it's always been like this. The Israeli occupation army has always been attacking ambulances, paramedics, primary healthcare centers, and hospitals and patients. You saw the incident in the West Bank where they dressed up as medical staff and went in and shot patients in their beds. No other nation on this planet are getting away with this kind of atrocities. So yes, the Palestinians in Gaza are completely clear about that. This is a tactic. This is part of the modus operandi of the Israeli occupation forces to diminish the capacity of the healthcare system, to bomb all the universities in Gaza are now bombed. Almost 60% of the schools are out of function. You have 500,000 school kids not having any teaching at all. And the hospitals are working far beyond capacity, and they've been on call for 4 months now. And it's only 12 foreign medical teams who have been allowed in by the Israeli occupation forces. So this is what the Palestinians are saying. You don't need to go to Hague to get the answer to the question, is this a genocide? This is a genocide in the making.
I'm presuming, because of the lack of aid and because of the conditions you've explained, that there are probably quite a lot of people who are going to these medical facilities with ailments, with injuries, that maybe normally they would survive, but because of the lack of the facilities and the aid coming in, they're actually dying because of that.
You're absolutely right, and we have an expression for this in medicine. I'm an emergency medical doctor, and we're talking about avoidable death. Avoidable death is that if you have a myocardial infarction, God forbid, and you are delayed to treatment so that you don't get open your coronary and you have a massive infarction and you die. In modern medicine, that should not have happened. So in Gaza now, and I just talked to the Minister of Health, Dr. Youssef Abou-Rish, who is a brilliant leader. He said, Dr. Mads, we're not losing most people from the bombing itself now. We are losing people from the triangle of death, which is starvation, dehydration, and diseases. 2.2 million people, they have myocardial infarction, they have strokes, they have diabetes, they have mental disorders, they have pregnancies which are troublesome, they have all types of diseases and cancer. None of these patient groups are currently being diagnosed, treated, or followed up. And these patients are dying. And 95% of the kids, according to the last report, are having diarrhea, in addition to being malnourished, dehydrated, and cold. So the numbers of avoidable death in the population is not recorded. It may well be the same level as the number of killed during the attacks, 29,000.
Mads, thank you so much for coming in and sharing your experiences, also your expertise with us. Much appreciated in this difficult time. Dr. Mads Gilbert is my guest here in the studio.